out whether we won't be able to tell whether the microbiome is a causal factor or it's just a consequence of cancer development, because cancer itself can influence the microbiome.
Sure. Yeah, absolutely.
And that's one area. I think the other area is survivorship. And I think we need more innovational studies, like more randomized clinical trials to consolidate the observational data, like I mentioned earlier, vitamin D, calcium, omega-3 fatty acid, coffee, they have all been linked to lower risk of recurrence of colon cancer, and the association are very strong compared to the relationship between these factors with cancer incidence. So I think there has been enough observational data, and what we really need is the randomized clinical trials that can provide the most robust evidence about whether improving these risk factors can really have a benefit on survival outcomes.
Sure. So my next question is, I know that the therapeutics themselves is not your area of focus. I know it runs tangential to the work that you do. You mentioned a lot of the standard of care that are used today. I guess first question is, what out there kind of excites you, if anything, that you see? I don't want anything that you're under CDA on, but when you look at the public domain or you see the research that's being done clinically, is there anything that jumps out at you that addresses some of the unmet that you've either mentioned here or that therapeutically seem to be very promising? Anything that kind of comes top of mind?
Yeah, I think the immunotherapy is the one that I am most interested in. And because inflammation is so important for colorectal cancer, like for all of the risk factors we have studied, one of the common mechanisms is through like inflammation. So it's not surprising that immunotherapy would have some benefit for colon cancer. And the question is how we can identify the right person for the right regimen, right? So right now the treatment is still kind of like takes a one-size-fits-all approach, and we need a more personalized approach to really optimize the benefit and to really target the treatment to patients who are who are more likely to benefit. And as I mentioned, microbiome is an important modulator of the immune system and has been shown to predict the response of immunotherapy. So I think I would be most interested in seeing more work in integrating like microbiome and immunotherapy for cancer treatment.
Okay. Tell me a little bit about maybe earlier stage diseases, right? So your stage 2, stage 3, or maybe your stage 4 oligometastatic, right, that are less dispersed. How well satisfied are those more local, but not super early, like not polyp, right? Not your early detection stages. How do those fit into the milieu of patients? Is that more about what these earlier stage patients you're talking about? I'm sorry, these younger patients you're talking about? Is that more these patients that we're catching with better screening?
Yeah, the early stage patients, right now their survival is pretty good. Like for localized cancers, the 5-year survival can be over 90%.
90.
Yeah, 90. Like even for regional disease, which means that there may be some lymph code involvement, we still say like 70 to 80% of 5-year survival.
Got it.
So also because the improvement in cancer screening.